Hi, everybody. Good morning, good afternoon, good evening, dear colleagues and friends, wherever you are. Today, we are going to have another webinar in the series of the webinars that GHD Infinite used to do on monthly basis. And today, we are going to address a very important topic indeed, which is the COVID-19 pandemic and the global environmental health, the effects and lessons. As we have all witnessed the past year, the COVID-19 pandemic has emphasized the importance of understanding the interface between animals, human, and the environment. The pandemic has revealed the great need for the collaborative efforts of multiple disciplines working locally, nationally, and globally to prevent the emergence of new diseases. The major factors behind the emergence of such diseases include intensive agriculture and stock farming, live animal threats, air and water pollution, climate changes, and rapid urbanization. It is very clear now that no one person, no single organization, no sector can solve the animal-human environmental interface problems alone. And the One Health approach aims to improve multi-sectoral coordination and collaboration to address health threats such as zoonotic diseases, food safety, and many others. One major sector necessary for the prevention and the recovery of the pandemic is the water sanitation and hygiene, the WASH services. The provision of safe water, sanitation, and waste management and hygienic conditions is essential for preventing and for protecting human health during all infectious disease outbreaks. The COVID-19 pandemic presents a learning opportunity to prevent future zoonotic pandemics and other communicable disease pandemics by focusing on the environmental sustainability and the ability to understand environmental and biological factors responsible for the development of new strains and their transmission. In today's webinar, we will have a global, regional, and national perspective. And for the national, we are going to use Sudan as an example to focus on that. In fact, today we have distinguished experts from at the global level, regional, and the one from, as I mentioned, from Sudan, to highlight this the issue of the COVID-19 pandemic and the global environmental health to address. Before introducing the first presenter, I would like to introduce myself. I'm Dr. Faris Lami. I'm Associate Professor and Head of Department of Community and Family Medicine in the College of Medicine, University of Baghdad. And I also worked as a public health consultant to a number of international agencies, including WHO, UNICEF, World Bank, and of course, GHD Infinite. As I mentioned, we have three presenters, and I'm going to start with the first presenter, Mr. Sayyid Yasser Ahmed. And Mr. Ahmed, he's a global WASH advisor at the International Medical Corps. In his role, he advises senior country management for managing the multi-donor WASH programs at communities and institutional levels. He also provides WASH technical support in all thematic focus areas of humanitarian action. Mr. Ahmed has extensive work experience really in emergency operation at country offices and headquarters of different organizations in the development sector, including international NGOs, national NGOs, and a public sector organization. He holds a master's degree in water and waste engineering from UK. Dr. Ahmed, you have 15 minutes for your presentation, and probably we will have 5 minutes for burning question because we are going to have the question later on. And just a notice and information for the colleagues for the attendees. You can use the question and answer in the on the chat box down. You can put your question in the Q&A, and if you have any other comments, you can put it in the chat. And we are going to review these questions so we can address them at the end of the three presentation. Dr. Ahmed, the floor is yours. Please go ahead.
Thank you very much. I would like to thank the team for giving me the opportunity to highlight a bit on the WASH landscape. The COVID situation has initially slowed down the humanitarian response, particularly on the non-COVID emergencies, interventions, limited humanitarian access, and worsened the overall WASH coverage for poor and most vulnerable. The world most destitute received the COVID shock on the top of existing major urban water and sanitation deficits. With the announcement of the emergency crisis measures that has affected the regular revenues from the water and sanitation service providers, with the potential revenue shortfall of 40% or more in many cases in the medium to long term, a clear lesson from the pandemic is that water and sanitation systems in the underserved areas must be expanded and improved. Moreover, the COVID pandemic has exposed long-lasting issues in WASH sector. Can we go back to the previous slide, please? Yep. Long-lasting issues in WASH sector. An estimated 60% of the people worldwide and only 38 in the least developed countries have primary hand washing facilities with soap and water at household level, leaving out over 3 billion people without any access to hand washing facilities. The water consumption and the wastewater generation worldwide has increased manifold due to the increased hand hygiene, cleaning, disinfection at household and institutional level. A serious threat to the fresh water available in limited quantities and especially in Jordanian context. Healthcare facilities are currently producing significant amount of additional solid waste, masks, gloves, etc. because of the pandemic. This type of waste is usually sent to landfill with the domestic waste. But during the pandemic, most has to be managed like other hazardous waste with special measures such as incineration put in place and service providers appropriately trained. The efficiency of the wastewater treatment plants has hampered, and we have seen that in multiple countries. Although the importance of WASH in fight against the COVID-19 is recognized, there is a lack of knowledge on the contribution of sanitation solutions to control the COVID-19. High exposure and contamination risks for the sanitation utility staffs working on the sewage systems. The COVID-19 has severely impacted an already overwhelmed healthcare service delivery globally at the community and institutional levels due to the lack of safe water access, adequate sanitation, infrastructure coverage, accessible hand washing facilities, and capacity of the communities and healthcare staff on themes related to health, hygiene, awareness, and infection prevention and control measures. For example, Yemen faces one of the most complex humanitarian emergencies of the modern times, with simultaneous cholera and COVID-19 outbreaks, which requires WASH services as a key part of the response. On the same note, we are getting used to the new norms of delivering the WASH interventions being risk-averse and to ensure that the staff prevention from the current pandemic. The lack of water sanitation access hinders human health safety during all infectious disease outbreaks, including the current COVID-19 outbreak. Increased water treatment and safe barriers, that is the sanitation facilities, will facilitate the more rapid inactivation of COVID-19. It's important to note that poor access to WASH also contributes to further health and malnutrition challenges. Inadequate access to WASH infection prevention control measures at health facilities during the current COVID-19 pandemic at times has led the frontline healthcare workers not to ensure equity care, therefore put themselves, their patients, and surrounding communities at risk of infection and even mortality. Lack of systematic attempt to adequately promote and mobilize healthcare staff and risk-informed communities on key public health themes such as hand hygiene, domestic and environmental hygiene, and social distancing practices to prevent or mitigate the current transmission of COVID-19. COVID-19 has heightened the particular vulnerabilities and needs of populations living in low capacity or humanitarian settings. Prevention and control measures such as implementing critical hygiene measures have been more challenges to implement, particularly in densely populated areas such as IDP and refugee camps. Provide specific technical guidance to COVID-19 pandemic. Identify the existing guidance development to adopt to support the WASH sectors and partners with the WASH strategies to mitigate the public health impact of the COVID-19. WASH interventions played a key role in providing service to other nexus, that is public health emergencies, than the usual programming to affect the population supported by the other sectors. Next slide, please. Now, how are we adapting to the COVID-19? Integration and coordination remains the key aspect of our current WASH sector roadmap. Hence, the key initiatives are planned to respond better towards the public health responses in coming 4 years. The idea with an aim to improve, trigger the systematic integration among the key sectors with WASH at global, national, subnational levels for integrated future public health and emergency responses. The initiatives revolve around the joint operational framework with the help of intersectorial work streams and key existing internal and external initiatives for integration of the public health emergencies. A phased approach to be adopted to look into intersectorial existing gaps, turning them into valuable resources for future integration and effectively delivering the public health responses. A joint operational framework is thus to be developed with the help of intersectorial work streams and key existing initiatives for better integration and coordination, especially in public health emergencies. Promotion of integrated multi-sectorial evidence generation from our work on the ground to inform the advocacy and fundraising. Achieving the SDG related to the WASH, health and nutrition requires new ways of working, partnerships, and greater innovation to enhance sustainability. Here, we look forward to working with you all in the future. Involve expanding the intersectorial expertise and incorporating the interdisciplinary approaches to achieve the public health outcomes. We need to revisit our approaches and collaboration that are critical for reducing the disease burden and producing various health, social, and economical benefits. Next slide, please. We need to put a bit more focus on, at the same note, getting used to the new norms for delivering the WASH interventions being risk averse versus the conventional direct community mobilization. We need to explore a bit more on the increased hand hygiene. The promotion of increased hand hygiene remains critical. Simple hand washing has provided to have more significant reduction in incidences of respiratory diseases, such as hand washing is only practiced only in every 5 people in the world. Mothers who regularly wash their hands can reduce fatal infections in newborn. However, the pandemic has also triggered the infodemics, misinformations, which needs to be addressed and looked into. Strengthen infection prevention and control. Infection prevention control measures put on barriers for human-to-human transmission and protects the individuals. Another top priority is to ensure that the institutional facilities such as health facilities, schools have uninterrupted basic WASH access. Make sure that there are hand washing facilities, for example, health centers, schools, public health spaces, communal sanitation facility must remain open with proper hand washing facilities, including soap and disinfectants, so that the people are not forced to defecate in the open. Given the importance of water and sanitation services and the extra pressure on the utilities caused by the current crisis, the sector may need extra support. Sanitation worker must be protected from additional risk associated with the pandemic. And in the last, environmental degradation and the climate change are key challenges to reducing the spread of infectious diseases. The wash sector needs to develop an in-depth understanding of relation between the public health and the environment. Thank you.
Well, thank you so much, Mr. Saeed, for this presentation, very concise and very precise indeed. And we are going to have some question later on probably. And just one issue I would like to highlight. You mentioned it very clearly, I think, which is it has the increased demand on water. Meanwhile, there is increase in the medical waste problem, I think, during this period. As far as wash, as we all noticed, it was the cornerstone in the non-pharmaceutical intervention that is used to prevent and control the COVID-19 pandemic. Are there any figures highlighting how much this the COVID-19 caused an increase in the water demand and increase in the medical waste? You can imagine that all the health facilities throughout the world are all the time overcrowded with huge number of people, and definitely a lot of these medical waste are being there. Are there any figures just to put the audience in the picture?
I'm really sorry, Dr. Faris, as we are working globally, and then this kind of like additional consumption rates has been increased, and same time the waste generation has been increased. We don't have any systematic documentation available on us to quantify the volume of the waste and the additional consumption has been. I would look into further, and if I find anything, I would be happy to share that. Thank you.
Thank you much. I appreciate it. Thank you so much. Thank you so much. Now we will have our colleague, Dr. May Masood. She will be our second presenter, and Dr. May holds a PhD in environmental management from Imperial College London. She is currently an associate professor at the Department of Environmental Health and director of the Inter-Faculty Graduate Environmental Sciences program of the American University of Beirut. She has over 60 publications, including articles in peer-reviewed international journals and the proceedings of international conferences. She is a recipient of the first prize of the Kingdom of Saudi Arabia Award for the Base Environmental Management Project for 2008-2010. Dr. Masood, the floor is yours, please. You have 15 minutes for your presentation, and we can have some 5 minutes. You can use it if you like, or we can keep it for some burning question. The floor is yours, yes, please.
You can see the presentation, right? Yeah?
Yes, yes.
All right. Good evening. I'm delighted to be here, of course, virtually, and to share with you my presentation about the impacts of COVID-19 pandemic on the environmental determinants of health. It's not the strongest of the species that survives, nor the most intelligent. It is the one that is most adaptable to change, by Charles Darwin. Adaptability was an important survival skill even before the COVID-19 pandemic. Now, more than ever, adaptability may be our best crucial skill. The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health. The quarantine imposed as a consequence is unprecedented in human history, as all the markets were shut down, places of worships were closed, public gatherings were banned, travel restrictions have been imposed, construction work halted, and the economy as well as stock exchange crashed worldwide. This disruption has brought about several effects on the environment. These effects can be positive. They are positive and negative effects. The positive effects, they are mainly improvement in air quality, reduction in criteria pollutants and greenhouse gas emissions, reduction in noise pollution, and ecological restoration. With regards to the negative effects, they were primarily in relation to waste in general, increased medical waste, increased plastic waste, increased the municipal solid waste in general, and the soil and water pollution, also the reduction in recycling activity. I will start first with the positive environmental effects. One of the most evident short-term effects of COVID-19 lockdown has been the dramatic improvement in air quality, especially in some of the world's most polluted cities. The shutdown of industrial facilities, power plants, the decreased transportation and shipping all resulted in decreased levels of the pollutants such as carbon monoxide, nitrogen oxide, methane, sulfur oxide, black carbon, particulate matter, PM10 and PM2.5. In this image here, you can see the pollution dwindling in Wuhan during the coronavirus pandemic. This is here the concentration of nitrogen oxide between January 1 and 2019, and you can see how it's decreasing, reaching February, between February 10 and 25, 2020, where the blue color resembles actually the lower NO2 levels. Again, here NO2 emissions in China before and after the lockdown, and you can see as well the reduction in the level of nitrogen oxide. The satellite estimates of NO2 over Southeast USA, again here you can see the same period, March 15, April 15, this is 2015, 2019, and again here the same period but in 2020, and the reduction in NO2 is clear and obvious as well. Comparison between expected and actual NO2 concentration in selected countries revealed that the measured concentrations with lockdown measures, which is basically this dark green color, they were lower than the expected concentrations without the lockdown measures, which is the light green color. And this was the case in all the selected countries. Also, there was a decrease in carbon emissions. As we all know, the carbon dioxide is a greenhouse gas, and it is among the other greenhouse gases that's responsible for climate change. The transportation sector, industries, and electricity have a huge contribution in the carbon dioxide emissions. Due to the coronavirus lockdown, the emissions of CO2 has decreased worldwide. For example, in the UK, it's around 48%, USA 7.5%, China around 18%. Also, comparison between expected and actual particulate matter 10 concentration in selected countries revealed that the measured concentrations with lockdown measures were all lower than the expected concentrations without the lockdown measure. Another positive environmental effect is basically reduction of water pollution. During the lockdown period, as we all know, major industrial sources of pollution have lessened or completely stopped, which helped to reduce the pollution load that led to an apparent positive effect on water quality. This is primarily the case in developing countries because mainly in developing countries, the industrial wastewater is usually discharged without any treatment into surface water bodies. Clean rivers and other water bodies have a significant positive effect on the aquatic life. Accordingly, many species are returning to their natural habitats since induction of the lockdown. The Grand Canal of Italy turned clear and many aquatic species reappeared. Water pollution was reduced in the beach areas of Bangladesh, Malaysia, Thailand, Maldives, and Indonesia. In India, the levels of various water quality parameters, pH, electric conductivity, dissolved oxygen, chemical oxygen demand, all these have reduced during the lockdown in comparison to the pre-lockdown period. Again, here, this is an image before and after of Venice resulting from the lockdown. Reduction of noise pollution is also a positive environmental effect due to the reduction in commercial activities and public transportation. Expectedly, noise pollution was also reduced. For example, in Delhi, the reduction was around 40 to 50%. While we have all grown accustomed to unhealthy noise level in cities, I believe that the short-term reduction during the lockdown allowed people to experience the immediate benefits of quieter cities. Lastly is the ecological restoration. As we all know, nature needs time to assimilate degradation resulting from human activity. Less traffic, less human intervention, and less pollution gave space to wildlife to thrive. During the lockdown phase, animals had an increased and uninterrupted territory. In some areas, wild animals were seen on roads and residential areas. And I'm sure many of you have seen or have shared these photos on various social media. Moving now to the negative environmental effects. As I've said earlier, it's mainly in relation to waste. There was a tremendous increase in healthcare waste. World Health Organization classifies all healthcare waste produced from patient care, which includes waste from COVID-19 infected patients, to be infectious. What distinguishes this category of waste is its ability to cause a more acute and rapid impact on human health and the environment than municipal or non-hazardous waste, primarily due to the pathological and infectious nature of some components within this waste. The novel COVID-19 virus has not only led to an increase in the volume of medical waste being produced, but has also caused an increase in one-time use items, as reuse is being avoided for the fear of transmitting the viruses. The increase in use of masks, gloves, and sanitizer bottles is noticeable in certain cities, where a significant portion of these items is winding up in the ocean and along beach lines. These are also common scenes during the lockdown, where you can see masks that are scattered across roads, sidewalks, and parks. And as we all know, such haphazard dumping of waste creates clogging in waterways and worsens environmental pollution. Definitely, risks are elevated in developing countries, as source segregation programs tend to be absent, and medical waste are often commingled with the municipal waste stream, which increases risks of formal and informal workers, such as scavengers and waste collectors, to come into contact with the hazardous and the contaminated waste. I believe the coronavirus waste, actually, it has become a new form of global pollution. The adopted quarantine, isolation, and social distancing led to a corresponding increase in the amount of municipal solid waste in general, around 15 to 25%, and a significant increase in the generation of medical waste in healthcare institutions from 10 to 20%. Also, the COVID-19 pandemic has caused significant changes in the production and consumption of plastics and in plastic waste, definitely due to the sudden surge in global demand for PPEs, gloves, masks, gowns, all of these. So due to the pandemic, quarantine policies established in many countries also have led to an increase in the demand of online shopping and online ordering of food, which also resulted in per capita increase in plastic use and packaging material. Several studies have highlighted the recent surge in the environmental footprint of plastics, given the reliance on single-use PPEs, which are thought to be advantageous due to their disposable nature, and definitely as public health concerns, they surpass environmental ones. It's estimated that almost 200 billion face masks and plastic gloves are used around the world every month during the pandemic. And I would like to note here that these disposable masks are made of plastic polymers, which are not biodegradable nor recyclable. Also, as a result of the pandemic, there was reduction in recycling activities in several countries, where recycling systems were downscaled or completely shut down over concerns of further contributing to the spread of the virus. For example, in the USA, they have restricted recycling programs in many cities, nearly 46%. In the United Kingdom, Italy, and other European countries, they have prohibited the infected residents from sorting their waste. Definitely, COVID-19 is not affecting all socioeconomic groups equally. Several factors may have increased the vulnerability of those with low socioeconomic status. Waste handlers and collectors in many countries are among the most exposed population and are at constant risk of exposure to this occupational hazard, given that sorting at source is minimal. This is further exacerbated by the unregulated nature of the waste sector in many countries that fail to train workers on the proper handling of waste and use of personal protective equipment. Another negative environmental effect is the decrease in public transport, which we are currently seeing as businesses start to open and more employees begin commuting again. Less and less commuters are using public transport in order to reduce their chances of getting the COVID-19. And as such, this is leading to an increase in single driver vehicles on the road, which is generally bad on a global scale. Impact on stray animals like dogs and cats that are affected by the pandemic owing to the absence of food waste material due to restaurants and shops being closed since the inception of the lockdown. And also, these animals, they were abandoned by their owners due to unfounded fears that they may spread COVID-19. Before moving to lessons learned and implications, I would like to note here that the positive and negative effects are evolving as the pandemic continues, and each effect may shift towards having more of a negative impact or positive impact than what is currently being predicted. Now for the lessons learned and the implications. Although a few positive impacts of COVID-19 on the environment were seen, these were the short-term effects induced largely by nationwide lockdowns. However, this will not be enough to eradicate or reverse the damage caused during many years. The pandemic is expected to cause long-term adverse effects on the environment in the future. The use of chemicals, soap, disinfectants, medicines, and plastics, gloves, sanitizer bottles, all of these, they are expected to increase environmental pollution. However, the positive environmental effects exemplify, and these may serve as an inspiration for future behavioral changes that would help us to bring positive effects on the environment. Actually, the lockdown gives us hope that there is a possibility of reducing the impact of anthropogenic activities on the environment. Therefore, proper strategies should be adopted to control environmental degradation. Decision and policy makers must take necessary steps so that this healing process doesn't become a temporary one. The short-term improvement in air quality suggests that clean energy-based systems have to be adopted as the corona outbreak ends, such as using less energy-intensive industries, cleaner fuels, technologies, and building strong energy-efficient policies, and definitely also increasing the share of renewable energy resources. It's essential to set policies and guidelines and implement them at the international and the national levels for a proper management of plastic, chemical waste, and wastewater treatment. And definitely the industries, they should adopt strong regulations to treat their waste, which can make the positive impact on aquatic life long-lasting. Also, there should be promoting reusing and the recycling of waste to facilitate the transition towards a preventive and circular system that is founded on the core principles of environmental management. About 60% of human infectious diseases are of animal origin. 3/4 of the new and emerging infectious diseases are transmitted to humans from animals. Evidence points to COVID-19 being a zoonotic. The emergence of such zoonotic pathogens is linked to environmental degradation and related to human interaction with animals in the food system. Definitely, the exposure to air pollution is associated with cardiovascular and respiratory disease. Both pre-existing health conditions identified as risk factors for death in COVID-19 patients. As such, long-term exposure to air pollution might be expected to increase human susceptibility to COVID-19. Therefore, I believe that there is a need for a collaborative and multidisciplinary approach, cutting across boundaries of animal, human, and environmental health. This is needed to understand the ecology of each emerging zoonotic disease in order to undertake a risk assessment and to develop plans for response and control. The One Health concept clearly focuses on the consequences, responses, and actions at the animal-human ecosystem interfaces. The scope of One Health embraces several disciplines and domains, including environmental and ecosystem health, ecology, land use and biodiversity, social sciences. So the interdisciplinary collaboration is at the heart of the One Health concept. I believe that the rational implementation of the One Health strategy should be our utmost priority to control the ongoing grave situation. COVID-19 pandemic is first and foremost a global health emergency with grave consequences on health and economy. The ongoing global pandemic has forced us to contemplate and imagine a different world. It exposed that there is a direct relationship between pollution levels and economic activities, such as industrial activities, transportation, and energy production. The lockdown also proved that a world with cleaner air is possible. In a period of just 2 to 3 months, recovery of nature is being witnessed by everyone. This is a signal, a sign for us to understand and react. It's high time to make a proper strategy for long-term benefit as well as sustainable environmental management. If no action is taken, the world will be on a dangerous path to devastating pollution. Lives, livelihoods, and the environment would pay an even higher price than they are today. Many solutions already exist to change that trend. What is needed is a dire action at all levels of society. And the time for action is definitely now. I would like to thank you for listening to my presentation. And back to you, Dr. Faris.
Thank you so much, Dr. May, for the very nice, very interesting presentation and very insightful slides as well. Thank you so much. And you raise a lot of points that I hope we are going to address in the during the questions and answer later on. As you had mentioned very nicely, and through the picture that you had presented, that nature is breathing again, nature is back again, and but after a short time, after something like 3 or 4 months, we faced with the increasing waste, medical waste everywhere, the mask, gowns, sometimes everything is in the streets and the sideways here and there, and I think this is quite important, and hopefully you will have time to address this issue. That's while we can keep the environment and restore the environment to clean again. But during this period, we have all the people at home. So, but meanwhile, we need the people out to do the job. But also, we want the environment to be clean again. So, how to make these two together? I think this is an important issue that, as you mentioned, probably the policymakers, the scientists need to think about strategies in order to ensure that both of them are doable. Keep people doing their job, getting their bread and butter. Meanwhile, we have to keep the environment clean and minimize the problem of emerging and re-emerging communicable disease. And as you mentioned very clearly, that the overwhelming majority of emerging disease are indeed zoonotic in origin, and which indicate, again, I think emphasizes the problem of the having these human, animal, and the environment interface, and how we make the good coordination in order to achieve the best for humankind. Thank you again for the excellent presentation, very nice, and we will come again to probably later on for these slides. Allow me now to introduce our third speaker for today's webinar, Dr. Asia Dahab. And Dr. Asia is the National Sanitation and Hygiene Coordinator, Global Water Sanitation and Hygiene WASH Program for the Federal Ministry of Health in Sudan. And Dr. Dahab has held several positions really in planning, implementing, and managing health promotion, food hygiene, environmental health, sanitation and hygiene with government institutions and universities communities. Dr. Asia, as you know, that you have 15 minutes for your presentation, and later on we will have probably some question and answer to address. Please, the floor is yours, Dr. Asia.
Thank you.
Okay.
Thank you for all who arranged this session. And now we present sorry for my presentation. My presentation, sorry for that.
No, it's okay, no worries.
No, it's okay now.
Perfect.
Thank you. Thank you for all. You know that.
But if you don't mind, Dr. Asia, to make it in a presentation mode, yes, perfect. Thank you.
Thank you. You know that the modern lifestyle, climate change. Now I will present the effect of the COVID-19 on environmental health in the Sudan. You know that the modern lifestyle, climate change, environmental degradation, and all this and the exposure to the chemical and physical stress, all these factors impact negatively to our environment. So as a result, many people really are in the disadvantageous position to face the pandemic with already impaired immune system due to the exposure to the environmental health hazard. Moreover, the ongoing pandemic has been associated with outdoor and indoor air pollution, water noise pollution, as my colleague may say that, and food security and plastic pollution. And this is clear in her presentation. Also, the inadequate infrastructure, lack of proper waste and wastewater management, and INUC's usual vulnerability reveal more links between environmental health and COVID-19 pandemic. Now I will say general overview on in the Sudan. Because of limit time, we put some highlight so that the COVID-19 has amplified existing vulnerability with wide range impact on the physical and mental well-being of vulnerable children and families, especially of girls and women. COVID-19 also has impact on the wider implementation of social services, including environmental health services. COVID-19 crisis also has highlighted the importance of safe water and sanitation and hygiene practices remain inadequate. About 5.3 million in the Sudan people lack access to improved water sources. Also, 6.2 million people lack access to improved sanitation, and 7.5 million people lack access to hygiene services. This presents significant challenge in containing the virus. You know that the Sudan population around 40 million of population with distributed in eight states. The capital is the capital of the Sudan, Khartoum. It contains about 10 million of people. Also, Sudan lack on regression to all the identification due to inaccessibility of previous public like toilet or resistance to share toilet under the pandemic in humanitarian situation. High financial cost of material due to our economic situation and labor may lead to reduction of response scale with limited funding case, community lack of hand washing infrastructure and hygiene supplies, which affect the hand washing activities. This is some highlight in our situation in the Sudan. Now we talk about the COVID-19 pandemic to the environmental health. You know that affected the health sector, COVID-19 affected health sector in virus environmental health activities. We greatly affected by the lockdown as some activities were suspended, especially food, water control, vector control, water supply. This routine activities when stopped has great impact on the water and sanitation sector, and also provision of safe water sanitation hygiene condition essential to protect the human health during all infection disease and outbreak include a COVID-19 outbreak. Ensure good and consequently apply wash and waste management practice in communities, home, school, marketplace, and healthcare facilities also will help prevent human-to-human transmission of COVID-19 virus. Sudan developed ODF roadmap to end the identification by 2022. But due to restriction on some activities related to mass gathering, triggering have negatively impact on achieving the goal and so negatively impact to achieve an SDG 6. We know that in the Sudan, we have around of 12 billion of around third of population in the Sudan practice of identification. So to achieve goal 6, SDG goal 6, we put the roadmap to end the identification in the Sudan by 2022. But unfortunately, due to the lockdown and due to we can gather people, all this stop the activities. And so now we are facing a big challenge to achieve this. So now we have updated our plan to shift for the 2025 or 2024, and all this will affect achieving the SDG goal. Also, the solid waste and medical waste sector was greatly affected by the lockdown because all the workers, the most workers in the Sudan, they have no job. They are temporary workers. So due to the economic condition, most of them from the work, which affect the collection, transportation of goods. This is يعني cause a big يعني transportation of and disposal of the solid waste and healthcare waste, because I see that this worker are temporary, and this now is a big challenge. They should have they should يعني find a job for all these people. This situation led to accumulation of waste. As May says that, Dr. May says that this waste is containing masks and containing gloves, especially in the cities. Also, the health facilities sponsors also identifies the lack of proper segregation, scarcity of waste containers, plastic bag, and a lack of WEBi as a major problem observed during the COVID-19 response period regarding waste handling. Also, Sudan suffered from the lack of significantly managed dump site. And also, this is another problem for disposal of solid waste. All the waste during the COVID-19, because there is no incinerator in the hospital or service facilities in most of the health facilities in the Sudan, mainly found in Khartoum town, Red Sea, and some of Darfur, and in some hospital, but majority of them, they have no incinerator, and this is also a challenge for disposal, treatment or disposal of the healthcare waste. This situation led to the collection of all waste. Most of them, they collect waste and then use chlorine for sterilization and then burn it. I say that the hazard of health and healthcare waste disposal during COVID big challenge for most health facilities with an absence of incinerator or autoclave. The COVID-19 pandemic had wide reach effect on nation, particularly on the agri-food system, like agriculture and food and nutrition security. Together with the multiple flood disaster, so we have different flood disaster, and now this year also we have flooding. This accelerated the effects of the ongoing economic crisis, resulting in new and unprecedented social stress. On conflict-borne areas, you know that in the Sudan there is different areas with conflict. This impact has been even greater as restriction, unemployment, and security concern block access to food market. It's clear that the COVID-19 pandemic has increased pressure on already strained economic and humanitarian situation in the Sudan. You know that also Sudan now we have different humanitarian situation. We have Syrian refugees in the two states, Kassala and Gaddafi state, and also this is a big challenge. And now also we have flood, and so this is a big challenge. On all this challenge, we have some innovation. We have some innovation happening in the Sudan. Innovation intervention such as solar hand pump help effective affordable scaling up access to improve water. You know that we have 40% of population have network connection. This is in Sudan. All people in the Sudan that have network connection is 40%. This 40%, 55% of them in the towns. So all the other people, they have no pipe in their houses. So we have another to use solar and to use pump to help other people to have water. So this solar help people help effective affordable scaling water. Also designed applicated innovation hand washing station using pedal without touching the tap and soap with minimize the risk of contamination. Involvement obvious help also in promoting effective intervention, especially in the area of innovation, prevention, and hygiene promotion during COVID-19. Also, I said that the people that connection with the network is not, most of them, they during the lockdown, they go to, to collect water. So this is one of the physical distance in water collection, used for people that not to catch the virus. We use this for that. This is one of the innovation. Uh, Also, this is another thing of innovation that, as I said, that not يعني the people that connected with water is only 40%, most of them in the cities. So this is called a brick. The brick used for anal cleaning and also for hand washing. This is someone innovation that with local material that just we press this as you see this picture, you use his leg to press this, then the water is coming out, and they wash without to touch this brick. This is called TB tap, and now we use this in the rural areas for the hand washing, and this is also, I think, that from the local material, there's no cost, and cost is zero. And also, in spite of restriction due to COVID-19, the Technical Sanitation Group developed series of guidelines related to CFDS and IPVs. This guide and also guidance note for home prevention against COVID-19. Also guidance note for primary healthcare facilities prevention against COVID-19. Also, we see that we correct some assessment for healthcare waste. So that a wash policy in healthcare facilities is highly needed to be developed. Also, we see that laws and legislation, we need to update it because before COVID, nothing about this pandemic in the laws and legislation. Now there is different committees to update the environmental health law, food safety laws, occupational health, and other health laws. Also update the environmental health strategic plan 2021 2025 to be aligned with the primary health strategic plan, and also update and develop a WASH strategic plan 2021-2025 and policy and the reform of WASH sector. Also preparing for opening of school because in September, first week of September, the school will be reopening. So different now activities will be prepared for the reopening of school. This is some highlight of the situation in Sudan. We see that affecting healthcare waste, solid waste, and wash sector. And this is all I presented. Thank you.
Thank you so much, Dr. Asia, for this very comprehensive presentation of WASH situation in Sudan. Can you please stop sharing? Yeah, thank you so much. Thank you. Now we have, I like, by the way, some of the slides that you have presented, particularly these tippy tap made from some local materials, and they were very impressive. That's how people can think about some innovative approaches, how to minimize possibility of a transmission of the COVID using different approaches. It was very, very nice indeed. And the area and the innovation of the solar as well to do that, something very interesting. So people are creative when they are put in the situation and they can do something in this regard. Thank you. Now we will come to the questions and answers. And in fact, there are a lot of questions that have been raised, and I'm going to address and our first of all, I think there is a question regarding the waste workers, and you mentioned, Dr. May, that those waste workers probably they are at high risk of exposure to COVID-19. The question is, is there any data about that? Is there any publication? And before you respond, I would like to say this is probably for our FETP colleagues throughout the region. Probably this is an area of research. to do that. So probably you are going to say something from international level, but again, for the region, let us think about and have some local figures and regional figures about this issue. Please, Dr. May.
Yeah, I've actually responded on the Q&A. Actually, I know the case of Lebanon, one of the largest waste companies here in Lebanon. Almost all of the workers in the company, they got infected by COVID-19. So, and this is the case that I know about here in Lebanon. I'm not sure whether there are cases or probably they will be published later.
Very good. I think again, I think I will raise this to some of my colleagues who I can see their names available from different FETP programs in the region, and probably they can keep this in mind in order to make some sort of a comparison between different groups and to identify whether those people are really they are at a risk group, and this is an area for research for all of us indeed. Another issue it had been raised that about a comparison between the alcohol hand rub solution that's used for as a disinfectant and the wash with water and soap. Which one is better, and shall we do both of them or one of them? I don't know who can respond to this question, but please feel free, Dr. Sayed, Dr. Asia, or Dr. May, if you have any information about such a comparison between the alcohol hand rub and the soap and water.
Hi, I will take the first stab, and then Dr. May and Dr. Asia can build on further. If you look into the WHO recommendations, it's very clear on what type and what compositions of the ABHRs should be used. Generally, it's more promoted to do the hand washing with soap and water or any other cleaning agent. Like if we look into the ABHRs, if your hands are clearly soiled, the ABHR are not going to be very functional, because if we look into the same example of having the turbid water and adding chlorine to it, which inactivates. So going back to the basics, washing hands with the soap and water is preferred, but it all depends. Like if you look into the health facility, and then when our health providers are looking into tending to different patients, and in between they cannot run to the wash basin and wash their hands and come back. So looking at the time and the effectiveness, that is also a preferred measure. But globally, if we look into it, the wash practitioners would be pushing a bit more or towards the soap and water or any other, like for example, in areas where we have limitations of soap availability, ash has also a disinfectant being used. Or if we go back to India and other places where other chemicals or local household level stuff has been used. So maybe Dr. May or Dr. Asia want to add something?
Actually, I second what Mr. Sayed said. I think the soap and water is a preferred option.
Okay, thank you so much. Dr. Asia, would you like to comment on this question? Dr. Asia, you are muted. Dr. Asia, you are muted. Please unmute yourself.
No, thank you. I have no.
Yes.
Because the hand washing is better, but it need availability of water and soap. No, as he said.
Yeah, thank you so much. Some question had been raised really about the positive and negatives that you very nicely highlighted, Dr. May, in this. The issue is, first of all, how long this positive effect is going to continue. That's first, and how to capitalize on these positives, and how to mitigate the negative in a practical and tangible way.
Definitely, the positive effects, they are short term. They will last. They will not last long. An improvement in air quality, even improvement in water quality, all of these, they are short term. Once the activities return, the transport activities, the energy sector activities, all these activities return, then we will return to the same situation. I believe that I prefer first, before discussing the mitigation, to discuss prevention. So I prefer to prevent these. From the beginning, I've said, particularly for the energy sector, probably we have to think about renewable energy resources, using more cleaner technologies. From the water pollution aspect, as I've said, this is mainly a problem in developing countries. All industries, most of the industries, they discharge their wastewater without any prior treatment into surface water bodies. So this is something that we have to do. There should be clear regulations, and they should have wastewater treatment before discharging into water bodies. So here, there is no need to mitigate. The mitigation probably is the wastewater treatment, the option of wastewater treatment. So all these, I believe that also an additional aspect is behavioral change. In the pandemic, these positive effects, they have showed us, and they serve actually as an inspiration, as I've said, for future behavioral changes, whether regarding waste, energy consumption, all of these aspects. So behavioral change at the level of the individuals, at the level of the government, definitely decision makers, policy makers, they have to set clear guidelines in order to, for industries primarily, to treat their wastewater, or using more efficient energy systems in order to reduce air pollution in general, all the greenhouse gases, not only carbon dioxide emissions.
Yeah, thank you. Thank you. Very informative indeed. And what about international agencies working in this arena? How they are looking to this problem? I mean, the positives and negatives of the COVID-19 regarding the environment. How they are going to capitalize on that? Let us hear first of all from Mr. Saeed, and later on probably Dr. May or Asya can comment on that as well.
If you look into the COVID, which has posed us a lot of challenges, but at the same time, it has given us the opportunities also to support the access. Like if you look into the challenges that we are facing with the conventional WASH messaging or activities that which were initially face-to-face, now we have started looking into use of the technology and others. So we are learning, and it's like a modular system where we are building on each block and moving forward. So it's a big opportunity for us to look into, and then bring good results home. So that's how I see it. And there is a lot of work that has been done and looking into how we are building. Let me go back to the basics of it. Like, for example, us WASH practitioners were blowing the trumpet for washing our hands constantly, regularly, and all that. And now we see a lot of momentum being gained on hand hygiene and others. But we need to be very clear, as Dr. May talked about the behavior change. Here we have reactive measures also. Like I will give you a very clear example from our Ebola response, like where there was a lot of Ebola happening, and people were putting these kind of signs on their houses and their restaurants that no hand washing, no entry. And once the Ebola epidemic was over, then people went back to their basics. So we need to go back to the basics and build on the practices that goes into the behavior change. It's not going to be an overnight thing, like Rome was not built in a night. Thank you.
Thank you. Thank you. Dr. May, would you like to comment on that as well, or that's okay?
It's okay.
Okay. Oh, thank you. Thank you so much. There is a question that had been raised several times from the audience, really, about the positive effect again of the COVID with the environment, and everybody was expecting to see something better for the environment this year after what happened during the 2020. All the people are locked at houses. Minimal mobilization, minimal travel. By the way, today I read that in 2020, 74% of international travel had been reduced if we compare to 2019. So it's a great reduction. While during 2008, during the financial crisis, this had been reduced by only 4%. So there is a lot of restriction and some improvement in the environment, just like you highlighted. But this year we are amazed nowadays with increasing floods everywhere. Global warming is still going on, so we are expecting to have something positive after that year. We're keeping everybody inside and having this positive effect on the environment, but we didn't get a lot really.
But I believe the pandemic actually, it has proved that there is a direct relationship, yeah, between these greenhouse gases and the anthropogenic activities. So this relationship is very clear. And there is no doubt that greenhouse gases, they cause climate change. Now it's time for us to do the right thing, which is basically to reduce these emissions. And in order to reduce these emissions, we have to put clear strategies. So probably you can see the benefit on the long term. It's not a short-term benefit. Unfortunately, this is the issue with environmental benefits. Most of the environmental benefits, they are long-term, and most of them, they are non-tangible, not monetary benefits. So people, they don't see these benefits on the short term. However, we have to look at the long term. Definitely, you can, if we continue with the reductions in these emissions, definitely there will be long-term benefits.
Yeah, we hope so. Dr. Said, probably you would like to say something. I can see you.
I just wanted to add a bit of alarming discussion that we are having, like looking into our Zatari camp, which is built on the freshwater aquifer for Jordan, and it's a fractured limestone formation. So looking at all that, and then how we are over-extracting and negative pressures being developed in all the water systems in Amman, and looking into that. So if we don't adopt, or I think we have missed the boat for the mitigation, but I think we have to look more into adopting ourselves. If we don't look into properly, I think Sana'a is going to be the first capital over the world, which will have no water in 10 to 15 years' time.
Thank you, Mr. Said, for that. Another question had been raised by one of the colleagues. Yeah, we mentioned that the negative impact on the environment probably can lead to increase in the emergence of zoonotic diseases, and some are suggesting or we'd like to hear some examples about these emerging zoonotic disease that we are expecting to see in the coming time after what happened now. Are there some specifics in mind about these zoonotic disease that can emerge?
Dr. Faris, the first thing would come to the mind would be the Ebola, and then looking into Zika and others. That's very specific to where we are responding, and it's a very limited catchment is quite limited. If you look into the 2014 response within Guinea, Liberia, and Sierra Leone, only 11,000 fatalities had happened. So looking into the zoonotic, it's a very strong imprint on how we are looking into the whole process. Thank you.
Yeah, thank you. Dr. May, would you like to comment on that, or shall I switch to another? You have electricity problem again everywhere. Okay. Yeah. Just waiting for Dr. May. Probably she would like to comment. Would you like to comment on this question about some examples about zoonotic disease that can emerge in the coming time due to this, what happened with the COVID-19 and the environment, or this disruption in the human-animal ecosystem?
Well, I believe definitely there is possibilities to have more emerging zoonotic diseases. And with having more viruses, bacteria, definitely there is the tendency to have more.
Yeah, and by the way, from my perspective, again, and correct me if I'm wrong, usually during these pandemics, the collateral damage that can occur, usually, sometimes they can even exceed the number of fatalities that come from the pandemic itself. Although in this pandemic, till now, the humanity had been lost something like 4 million individuals directly from COVID, but I'm expecting that the number of fatalities due to indirectly related to COVID can be even higher. And just an example from Iraq, let us say, would like to say, very specific about zoonotic disease. Currently, we see more cases of the Crimean Congo hemorrhagic fever, for example, simply because of the suspension of many control measures that we used before in order to control these medical insects, ticks, and mosquitoes, etc., etc. And the same is applied for the rabies. For example, we start seeing more cases of rabies simply because the usual control measures that you use for the stray dogs and others had been almost stopped or suspended. And this applies to many others. Nowadays, even we can see that certain types of mosquitoes which are not present before, we seeing it in the country. And Aedes aegypti is an example of that. And with Aedes aegypti, we are expecting to see dengue fever, for example, in the coming time, yellow fever, and some others. So again, I think not probably the direct impact, but sometimes the indirect impact of suspension of the different control measures and the preventive measure that the Ministry of Health, Ministry of Agriculture used to do, it will lead to this to emergence of these diseases or re-emergence of an old diseases. Again, I think this just we mentioned in our introduction about the intensive agricultural and livestock farming, the live animal trade, the air and water pollution, the climate change, and rapid urbanization. This will bring a human and wild animal very close to each other, and probably this the kingdom, the animal kingdom and the human kingdom, probably they are going to share some pathogens among them, and this is probably the area how the emergence of new diseases, particularly zoonotic, again, as you mentioned, will be high. So I think we have to think about it in a very wide scope, because we have this pandemic now, as we mentioned, the number of fatalities exceed 4 million. But if we continue with this process of deforestation, etc., we are going to see probably another pandemic, not after 100 years, but probably even after shorter time. So I think this is from my perspective, again, and you are the expert people in this arena. I mean, globally, people at international organization, politic leaders throughout the globe, they have to think seriously about that. What are your impression about how global leaders they are going to control this issue and to prevent another pandemic in the coming 10 years or 15 years, not in the coming 100 years?
Thank you. I want to give some comments about this zoonotic diseases. As you see that or know that in the Sudan, we have hemorrhagic fever, we have dengue fevers, and other fevers or diseases before this COVID-19, and also this sometimes there is a mix of diagnosis of COVID and these diseases. And so the COVID-19 is also make a challenge for our situation. Also, we have, as we said, that we have this situation. So the COVID-19 is more affected our situation and control, because early we have this endemics, endemic diseases in different states of the Sudan. COVID is another burden of our already endemic diseases in our country.
Yeah, thank you, Dr. Asia. And another question for you, Dr. Asia, if you don't mind. There is a question about what is the best WASH intervention for Khartoum in Sudan, considering that Khartoum representing something like 25% of the population.
Khartoum, as I answered this question, but again I will say, Khartoum, yes, it is percent 25% of the population, or more than that, even Khartoum. WASH does not work at cities, but in Khartoum instead we have displaced and refugees in some Khartoum have 7 localities. In 2 localities we have displaced people and some refugees people not returned back. So in these remote areas, they live in remote areas. So in these remote areas, WASH is working as sanitation, mainly sanitation, because there is a big problem of sanitation in these areas, hygiene promotion. There is water, underground water. So the washes work as a disinfection of this or chlorination of this water to reach people safety. This is what wash done in Khartoum state. But because all other Khartoum state is connected with water and is the capital of the Sudan, not need all this, but work in these remote areas because it's needed area. Thank you.
Thank you, Dr. Asya. There is a question from our colleague Islam Saeed from Afghanistan. How to keep a balance on support and attention of each component of One Health? Mr. Saeed, would you, or Dr. May? Okay, go ahead, please. Dr. May, would you like to come? Okay, Mr. Saeed, if you like.
I think if we are looking into health and the impact it has, so we need to be very comprehensive about how we are reaching our beneficiaries, or looking into the bigger sectors and its integration with the health, nutrition, and WASH. So to have bigger impacts, we need to work not in silos, but work towards one goal. And then if you look into all the different activities and then the human well-being and health, all the different contributing like mental health, like nutrition, like the gender-based violence, and looking into the child protection and others, they are very much contributing towards the umbrella objective of One Health. So we should not be looking into all these interventions siloed, because for example, a classic example would come to mind would be an intervention, nutrition interventions where we are providing the stunting activity with the children, but the children go back to the village and they drink the same unsafe or unprotected water. So all the resources that has been put in place are wasted. And same time, if we go back to the cholera OCVs and then look into if we provide the one or the second doses, and then same time, we are not looking into a clear integrated programming, then the impact of the health would be lesser and would suffer. More people would suffer.
Thank you. Thank you. Any comment from your side, Dr. May, for this particular question?
I also agree that collaboration and also integration here are key aspects here. So the collaboration and partnerships among the multi-sectoral personnel is needed for the implementation of the One Health strategy. So it's not like Sayed said, it's not in silos. We have to integrate all these multidisciplinary aspects and collaborate together.
Now, how to operationalize these collaboration? We frequently, I can see in our country, for example, we say it a lot, but on the ground, little is seen. So how to make this, I mean, a routine day-to-day activity to bring those people together? Any examples from countries in the region or somewhere in the world that had successful example in this area?
The classic example would come to the mind would be a cholera response in Yemen, where the health, WASH, and other activities or other sectors were integrating. So if we look into our global WASH cluster or the WASH sectors roadmap, which is the 2020 to 2025, which has multiple initiatives which are very specifically drilling down into public health responses and public health emergencies and how we are responding. So International Medical Corps with the Save the Children are looking into collecting this kind of evidence, and soon I would be happy to share some documentation and evidence on that one. So at the same time, it's a very phased approach, and if you look into my adapting to COVID-19, I think I've listed down a couple of activities that needs to be looked into, adhered to, and owned. Thank you.
Thank you. Thank you so much. Another question that had been raised by one of the colleagues, probably it had been addressed in some way or another. Are there some contingency plan to address the negative impacts or effects of the COVID-19 on the environment? And what about the role of international agencies in doing that to prepare ourselves for the coming pandemic? particularly in the arena of the environment. Probably we'll think of field epidemiology, the surveillance, and public health labs. But what about contingency plan in regard to the environmental effect? Are there some contingency plan in this regard? Are there some thoughts and opinions about that? Yeah, you can start, or Dr. May, would you like to comment on this, or?
Yeah, as I've said, I'm not sure whether we have to develop an emergency plan, but I believe that all the solutions, they exist. What's needed now is the action. We have the solutions. We know the solutions since a long time. We know what we're supposed to do, but we need the will to do this, the political will mainly to do this, and we need to act. So the solutions exist. Just let's act. This is what's needed, I believe.
Yeah, great. And
Dr. Faris, like the classic example would be like how we were looking into environmental mitigation and all that. So we have been waiting, and as Dr. May has very clearly outlined that we did not act. So we have missed the boat on the mitigation also. Thank you.
Thank you so much. So again, I really echo what you mentioned, Dr. May. That's the knowledge is there, the need is there, but the will is not there. So what probably is needed is to bring people together and to address these issues. Let us think from this forum about some initiatives in this regard. How can we do that? Probably we and the colleagues, the attendees of this particular forum, and let us ask GHD Infinite in order to think deeply in this regard, how to work closely among the countries in the region with support of international organization, IMC, other partners, in order to give a hand for the countries in the region. And most of them, they are usually they are developing countries. Many of them, they are facing serious human disaster. Probably the largest number of refugees in the world are in this region, the largest number of IDPs are in this region, and so on. So what can we do together in order to prepare ourselves and to push things forward? So probably I will put this on the table of GHD Infinite to think about, and probably we may think of certain initiatives to address this point. And if you have any comments, my colleagues, Dr. Sayed, Dr. May, and Dr. Asi, if you have any comment before closing.
Thank you. I think, as May said, and you, that now everyone in all world, they know what is happening and how to do. But we should all together now to work as the world, not as African as the world, because the pandemic it will also well. So we should work together. And also I said as you said that we have innovation now to work together to know how to do for our people, for our world, to use we know that all the positive and negative impact for environmental health. So it's the time. It's the time to work together. Thank you.
Thank you, Dr. Asi. Thank you. Dr. May?
I totally agree with you, Dr. Faris. I believe probably let's use this platform, starting from this platform, to try to make more. Let's start with the regional impact and see how we can really be prepared for emergencies, for all these cases that we need to collaborate together in order to solve problems. So hopefully there will be a continuation to this webinar, continuation and action, real action actually, to what we are discussing now.
Yeah, thank you so much. And to capitalize on the positive impacts that you had just highlighted very nicely, and mitigating the negative impacts that you again highlighted in your slides.
Mitigating or try to preventing.
Preventing. Yeah. Totally agree.
Then with the mitigation.
Totally agree with you. Thank you. And Mr. Sayed, please.
Yeah, I think I'm going to summarize in a couple of words, just to say that charity begins at home. We need to take action of our own bad deeds. So I think from there we can pick it up and look into how we can form and close collaborations can be established. At this point, I think there are a couple of initiatives which are looking into the public health responses and how we can make the challenges. Happy to have a discussion with Dr. Faris, Dr. May, and Dr. Asya further, and how you guys can chip in and plug in into these initiatives that the global sector or the global WASH sector is running currently. Let's have an offline discussion a bit more. So to see how the region can plug in into the different initiatives that you guys are going to put on your forums, and how these different synergies can be combined.
Thank you so much. Thank you so much. And on behalf of GHD Infinite, I would like to really thank you so much for your presence in this webinar and for the great presentation that you present. A lot of new knowledge for me, and I'm sure that's applied for our participants and the audience from different countries in the region. And hopefully we will have another session as we agreed, in order to deep dive for in this area, and to finally probably we can put some tangible activities in order to again to prevent, mitigate, and capitalize on positive impacts of that had been faced. As you had well mentioned, that the knowledge is there, the need is there, but we need to operationalize this in order to have something on the table and for the benefit of the people in the region. I would like also to thank all the attendees for their time, and thanks a lot to the colleagues from GHD Infinite who are working behind the scene in order to have this webinar. And hopefully we will see you again in another webinar on another important topic relevant to COVID and other topics as well. Thank you so much, and have a great day. Bye.
Bye.
Thank you, everybody. Have a good evening, good night, and enjoy your time.
Thank you. Thank you so much. Thank you.
Take
Thank you
care.
so much.
Bye-bye.
Bye-bye.
Bye.
Bye.
Bye.